Good morning. I'm your host, Elizabeth Cato, and welcome to English 2089. People around the world today are living a new normal due to the coronavirus. Children are becoming accustomed to virtual learning, parents are working from home, and health professionals are out there risking their safety to help prevent the spread of COVID-19. In order to become accustomed to the new normal, one profession has resorted to moving their practice to being strictly online to serve their patients without the need of meeting in person. This is known as telepractice. According to the American Speech-Language Association, telepractice is the application of telecommunication technology to the delivery of speech-language pathology and audiology professional services at a distance by linking clinician to client and clinician to clinician for the assessment, intervention, and/or consultation. The American Speech-Language Association adopted the term telepractice rather than the frequently used term telehealth or telemedicine to avoid any misperception that these services are only used in healthcare settings. But what does telepractice entail? Is it as effective as in-person consultation? Will telepractice take over and become the new speech therapy? To help give insight to the questions, we are going to hear from Colleen Cato, a licensed speech pathologist at Buckeye Local School District, and she also happens to be my mom. So, how are you today, Mom?
I'm doing well, thank you.
So tell us about what you do for a living.
Well, I am a school-based speech-language pathologist, and I provide services at Buckeye Local School District from children ages 3 to 18, so I service the entire district.
Okay. So, what are your general, responsibilities for the students, and what does a typical school day look like for you?
Well, my job is to provide direct and indirect services. I work with about 40 students on my caseload and provide direct instruction, help them with their speech sound productions, help them with talking, with understanding vocabulary.
Okay.
A typical school day?
Yeah.
Well, I usually start my day right around 7:30. I don't just serve students. I check my emails. I consult and collaborate with the regular ed and special ed teachers, because a lot of times we serve the same students. I hold meetings. I do assessments as well as screenings for students that teachers are concerned about.
Okay. So how has moving from in-person practice to online practice affected you? Is it easier for you? Is it harder for you? Is it about the same? Any recurring issues?
It has turned my world upside down.
Okay.
I have been in the school setting now for about 15, 16 years.
Okay.
Everything is online. The prep is a lot different. As the digital world has taken over, my materials have had to be turned into materials that I can post so the students can see what we're looking at. I do have some digital interactive materials that help keep the students engaged.
Okay.
That is probably the hardest part because my preschoolers are very, very busy. I have about 20 students that are preschool age, and so now it's therapy with me on one end and parents on the other end. The students are the same as far as their behaviors, but I think the parents are a little having a hard time because they're the ones that have to be
Get them
the
to focus
and help them focus, whereas that usually was all on me.
So do you think age plays a factor in the effectiveness of telepractice?
I think it's different. I think I'm doing more therapy with parents too, which I actually kind of like.
To get them to reinforce it at home.
Correct.
Okay.
And I think that helps them see what we're doing.
Okay.
I think their progress is coming along. It's not, for the preschoolers, it's not as fast, but it's not as fast as it would be even if we were in person. School age students, they're doing okay.
Okay.
they're a little more tech savvy than I am. So the transition to paper pencil or in person is okay. When it's online. I do have some students that are autistic. Their focus is a little better. There's not as many extraneous and outside sensory things that could be contributing to their frustration because they are at home. So that's helpful in that respect. I do find myself doing more planning. I find myself actually spending a lot of time emailing and talking to teachers more so on the phone and through the email than just walking down the hallway and chatting with them.
Yeah.
So that's a new normal for me.
Okay. Okay. So there was a study done by the Department of Speech Pathology and Audiology at Kent State University and at the University of Cincinnati. And they researched if telepractice showed any more effectiveness than a traditional in-person study, and they actually saw a result saying that it was roughly about the same, but they did it on school-age children between the ages of 8 and 14. So it's interesting that a lot of your students are like preschoolers and like kindergartners, because do you think that's around a time a lot of speech is developed compared to when they're older?
When they're in preschool, there's a lot of development that happens, and the earlier you start, the better the outcome for when they go into school age. That's why we serve preschoolers. I think the biggest impact for preschoolers is because we don't just serve them in a therapy setting. We have them bombarded with typical peers and typical developing peers, which is part of why the preschoolers do better, is because there are things that you can teach in direct modeling and individual therapy, but they're practicing it with their peers. Plus their attention spans are so much shorter. So the advantage for me being in person is I can do short little sessions throughout the 4 or 5 day week that we have them.
Yeah.
I don't necessarily have that now.
Do you have to like pick out a schedule of like what days you see certain kids? Is it only once a week now for like longer periods of time, or about the same amount of time?
Some students I have twice a week. Other students I have once a week, and then follow up with having practice at home with the parents. The really, really severe students, I don't have the reinforcement like I do with the teachers.
Okay.
Because our intervention specialists that do work with our students are also reinforcing the entire time they're in there. I'd be very curious as to how my preschoolers are going to look when we come back in the fall. Right now they're maintaining what they have. They're not making the jumps like I would like to see, or what I've seen last spring compared to this spring. But again, I just think it's because they're at home and they're not with me. So that part is a little harder. Do I think school age kids are progressing like they would online versus? Yes.
Okay.
I think. But I also think there are some things with the speech language pathology practices, because it's not just speech and language. Voice therapy is okay, but when you're working with swallowing and things like that, that's probably a little more challenging and may not necessarily be appropriate for online.
Okay. So another thing that telepractice usually treats are chronic aphasia patients who suffer from strokes and different things like that, and have brain injuries and trauma to the brain that affected their speech, and then like stuttering. So do you think that maybe in the future telepractice will become more common for those type of cases rather than the type of people that you work with, or do you think it will roughly progress to the same amount with every single type of case?
Yeah, I don't know that it would be an all inclusive.
Okay.
Only because every patient is individualized. And there are some patients that telepractice just isn't effective for them. I mean, you can do stuttering therapy. I have a couple of clients that I work with that are stutterers, and they do fine online. But getting them out in person may be the issue. So when we're doing therapy online, they're not showing any problems with their stuttering. It's when they're going out and
doing like public speaking and things like that.
Correct. And we can practice all day long online and they're fine. But getting them out of their comfort zone is where they may have more issues.
Okay.
And that part of therapy has to be able to happen. So do I think the aphasia patients, again, there's a lot that goes into aphasia therapy because there's a lot of other things, not just the language piece, that may have to be addressed. So do I think it's going to be an all-inclusive practice or delivery of service? No, I don't. I think it still has to be individualized.
Okay, so it's like depending on the person then.
It's all depending on what the client's needs are.
Okay, okay. So speech impediments, do you think I would have been okay on telepractice?
No, because you were 3.
When we were working on a lot of things.
You were 3, we were working on a lot of things, and I think, again, when you're 3, 4, and 5, a lot of what we do is play because that keeps your interest. And in order to carry over your skills, it's through play. While this is a very sterile environment being on the other end of the computer, I don't get to get down and play with you. I am with you on this side, showing whoever's with you how to play. I mean, again, for right now in the situation that we are in, it is what we can do, and it's the best that we can do at this point. But is there a better way? Yes, there is.
Okay. So one final question for you. So do you think that telepractice is going to become the new speech therapy?
No, I do not. I think it's just going to be another avenue to explore, especially to get services to those who may not be able to get in to see someone.
Okay. A different avenue.
A different avenue.
Okay. Well, thank you for your time. Really appreciate it. I hope I get an A now.
Thank you.
Have a good rest of your day.
Yes.